Rutherford County officials threatened to shut down a restaurant in Spindale today after the owner tried to restart dine-in services. News 13's Caitlin Penner spoke with that owner. And Caitlin, he says that officials showed up an hour after he opened up this morning.
Yes, owner Mike Spina says that he opened at 6 this morning, and by 7 he says there was a sheriff's deputy, a fire marshal, and a representative from the state's task force saying that if he didn't stop what he was doing, he could get his health permit taken away. He says he was also told that he could get fined up to $1,000 and given a Class 2 misdemeanor. He said he and co-owner Linda Fortner decided to reopen after they didn't get any of the small business loans they applied for. He says they had to put their 2 waitresses on salary because they weren't making enough tips with takeout, and he says they were social distancing and sanitizing this morning. He had this message for Governor Cooper.
Listen what I got to say to you, okay? You need to change your mind and open up these stores before you destroy North Carolina, because it's wrong what you're doing.
The Foothills Health District Public Health Director gave us a statement saying, in part, if one person is positive in a restaurant, then we potentially have an entire restaurant full of positive patients. Going on to say she urges all businesses to follow the governor's orders as we make strides towards protecting all.
While most elective medical procedures have been placed on hold, Mission also says they've seen a decrease in patients for critical care, things like strokes and heart attacks. They don't believe that that decrease in patients is an indicator that there are fewer instances of critical cases. This has them concerned.
We've seen dramatic declines in volumes in emergency departments, 30-40%, even higher declines. I find that number exceptionally troubling. What it means to me is that people have put in their minds the fear of acquiring COVID-19 disease.
One of the biggest concerns is heart attacks.
If you're having chest pain, shortness of breath, you're nauseated, feel sick at your stomach.
All symptoms that require medical attention.
People are still having heart attacks, and what we want them to know is that the sooner you get to us, the sooner we can help you.
Angela Soulsby is a nurse at Mission. She says the effects of not seeking immediate treatment can be long-lasting.
Their heart muscle is damaged and it doesn't recover, so it doesn't pump as well.
There have also been a decreased number of stroke cases coming into the emergency room.
And it's imperative that if you think you're having a stroke, to call 911 and to be assessed.
Those symptoms can be made into the acronym FAST, which includes face drooping, arm weakness, and speech difficulty. All of these mean time is critical.
The longer you have the brain going without blood flow, that's what causes the stroke. The more damage that can be done to the brain.
Any treatment ignored can be costly.
The long-term effects are really disability and potentially death.
Mission has protocols in place, and they want patients to seek help immediately if they think they are having problems.
Being cooped up at home makes it tempting to cozy up to some not-so-good-for-you comfort food. But perhaps now more than ever, it's important to stick to a healthy diet.
The food you choose to eat right now can support your immune system and boost your energy levels. So making nutritious choices is really important.
Health officials advise that we stay home as much as possible, and that includes minimizing trips to the grocery store. Before you go out shopping, check the cabinets and freezer. You may have plenty of food to work with already.
You can make whole meals that are pretty tasty from the things that you have in your pantry, like canned beans or canned fish, grains, pasta, and then you can supplement with fresh food that you've got in your freezer.
For instance, oatmeal makes a healthy breakfast, but add some peanut butter and cinnamon, then top it with thawed frozen berries and a little honey, and you've got a protein-packed bowl of deliciousness, all from the pantry. And for lunch or dinner, now is the perfect time to try your hand at homemade soup. Sautéed onion and garlic are a flavorful start to any soup. Add several cups of your favorite veggies, frozen if you don't have fresh, followed by 4 cups of low-sodium chicken broth, and you have a very basic soup. Use your pantry to jazz it up with a can of beans, a handful of dried pasta, and your favorite spices. And soups are a great way to use up leftovers. And when you go to restock your pantry, pick up some other long-lasting staples to enhance your meals. Cottage cheese and ricotta can last up to 2 weeks in your fridge. And sturdy produce like apples, winter squash, carrots, and cabbage will last up to 2 weeks if kept in a cool, dry place. So do yourself a favor, peek inside your pantry and look inside the box.